You finally decide to look into GLP-1 medications like Ozempic, Wegovy, or Zepbound, and instead of just walking out with a prescription, you're handed an order for this massive panel of mandatory blood tests.
Right, which has to feel like hitting a total brick wall. I mean, you've already dealt with the frustration of failed diets, the embarrassment, the metabolic slowdown, and now there's just another hurdle.
Yeah, it really does feel like that. But those tests are actually the secret window into how these medications are going to interact with your specific biology, which is exactly what we're unpacking in this episode.
Wait, let me just stop you there for a second. If these are weight loss drugs, why are doctors checking like liver and kidney function instead of just putting you on a scale?
Well, it really comes down to how your body processes the drug. GLP-1s don't just sit in your stomach. They actively alter your insulin secretion and slow down digestion.
Oh, I see. So the medication fundamentally changes your metabolic workload.
Exactly. It forces your liver and kidneys to work totally differently to filter your blood, so they need a baseline check of your organ function first.
So doing these labs is kind of like running a full diagnostic on a car's engine before you completely change the fuel system.
That is a perfect analogy, yeah. And that's why the screening is so comprehensive. They check your A1C, your thyroid, your lipid panels, and your liver function.
Okay, I get the A1C and cholesterol, but wait, liver function? Why is the liver taking on a different workload?
Well, the liver is crucial because these drugs mobilize stored fat, which the liver then has to process. And research shows that 25 to 30% of adults quietly have fatty liver disease.
Wait, really? Almost a third of adults?
Yeah.
That's actually wild.
Yeah, without even knowing it. And if your liver is already compromised by hitting fat, forcing it to process even more fat could actually be dangerous.
Wow, okay, that makes total sense. So adding the medication could just overload an already struggling organ.
Right. They also check kidney function for a similar reason. If your kidneys aren't filtering waste properly, the medication can just build up in your system and cause severe side effects.
Okay, but let me clarify something that I see misunderstood all the time.
hmm
If your labs come back totally normal, does that disqualify you from getting the medication?
Oh, no, not at all. Normal labs just give your doctor a clean safety baseline so they can monitor your organs over time.
So stepping back for a second, what this really means is these blood tests aren't like a pass-fail exam for obesity.
Yeah.
It's more about proving this is a full metabolic health issue.
Exactly. It's a map of your underlying health. And the research shows that insulin resistance usually shows up in these blood tests years before diabetes is ever officially diagnosed.
That entirely reframes the timeline of weight gain. I mean, it's not a behavioral flaw, it's a biological condition that's been developing quietly in the background.
Right, which is exactly why reversing it isn't some overnight miracle fix. Because GLP-1s are literally repairing those deep metabolic pathways, the weight reduction is a super gradual process.
And I guess that gradual timeline totally explains those treatment plateaus people experience, right?
Oh, absolutely. If your body is doing all this complex internal repair, the scale isn't going to just drop linearly every single week.
You know, interestingly, something that kept coming up in the patient case studies and discussions I was looking at was medically supervised GLP-1 programs.
Yeah, we're definitely seeing a shift away from people just seeking out the medication alone. The standalone weekly injection just isn't enough for everyone.
Right. People are realizing they need a much broader strategy to handle things like side effects and those annoying plateaus.
Exactly. Those medically supervised programs combine physician oversight, ongoing labs, nutrition, and, behavioral coaching.
Having a doctor interpret your follow-up labs while a coach helps you adjust your nutrition sounds way safer than just guessing your way through it alone.
It really is. And if you want to learn more about the specific supervised program referenced in the research, you can actually find a link right down in the description.
Yeah, definitely check that out. But, before we wrap up, I keep coming back to one last curious thought.
Oh, yeah. What's that?
What if the most important takeaway from GLP-1s isn't even the weight loss itself, but finally proving to the world that our bodies are fighting these complex biological battles we couldn't even see without these blood tests?